Are you getting ready to enroll in Medicare and interested in Part D, your prescription drug coverage? Are you confused about how and when to enroll in the mysterious donut hole? Hi, my name is Sarah, and I'm here today with iHealthBrokers to discuss Medicare Part D, your prescription drug coverage. Medicare Part D is arguably one of the most complicated parts of Medicare. In this video, we're going to be discussing how and when to enroll in Medicare, the 4 stages of Medicare Part D, the 5 tiers of medication, and of course the financial considerations. Now you can go at your own, in which case you would access the Plan Finder on Medicare.gov, that's Medicare.gov, but because there are such a myriad of different options available, we highly recommend that you contact a licensed health insurance broker. If you'd like any help, you can give us a call at 888-410-0344. We are licensed health insurance brokers and we work for you, not the insurance company, and we do it at no cost. The benefit of working with a broker is that you have a third-party liaison who really is on your team to help you find the best plan for you at the right price. And of course, should there be any confusion down the line, we handle it for you. All right, let's get back to Medicare Part D. Medicare Part D covers prescription drugs not covered by Medicare Part A or Part B. You cannot get prescription drug coverage through a Medicare supplement plan, also known as a Medigap plan. However, you can get it with a Medicare Advantage plan, and we'll talk about that in another video. Your open enrollment period is the same as your open enrollment period for Medicare Parts A and B. So that would be the 3 months before you turn 65, the month of your 65th birthday, and of course those 3 months after. Now this same period of time is applicable if you're receiving Medicare through disability. You may also be eligible for a special enrollment period. Let's say you defer Medicare because you're still working. Well, you may be eligible for a special enrollment period. However, we encourage you to contact a broker in advance and make sure, because that list of qualifying events is long, but you want to make sure that you are in fact qualified. Otherwise, you could end up paying a late penalty. And of course, you always have the option to enroll during the annual enrollment period, and that's the same time every year. It's October 15th through December 7th. But like I said, if you enroll outside your open enrollment period or a special enrollment period, if you're qualified, you may be subject to a late penalty, and nobody wants that. Medicare Part D is offered by private carriers, but it is regulated by Medicare. Now, all Medicare Part D plans must meet these federal guidelines. Carriers can compete to offer better benefits, but they must meet the guidelines no matter what. And there are 4 stages to Medicare Part D. Stage 1, the deductible. Stage 2, the initial coverage period. Stage 3, the coverage gap, also known as the donut hole. And Stage 4, catastrophic coverage. Every year, Medicare sets a max deductible that any carrier can charge. For 2020, this max deductible is $435. This max deductible does tend to increase on a yearly basis to accommodate for inflation and rising healthcare costs. However, for 2020, the max is $435. Now, a carrier can choose to waive it or lower the amount to compete for your business. While you're in the deductible period, all prescription drug costs are out of pocket, which means that if your drug costs $75, you pay $75, but you only do so until you meet that deductible. At that point, you move on to Stage 2, the initial coverage period. Once you have met your deductible, you move on to Stage 2, which is the initial coverage period. In Stage 2, you'll be responsible for copays. The amount of the copay is dependent upon the tier of the medication. You've probably heard of tiers in relation to Medicare Part D. And there are 5 tiers. Tier 1 is preferred generic, Tier 2 is non-preferred generic, Tier 3 is preferred brand, Tier 4 is non-preferred brand, and Tier 5 is specialty medication. Now Stage 2, like Stage 1, is capped. This year in 2020, it's capped at $4,020. So Medicare keeps track of how much you spend out of pocket, contributing to those copays, and how much Medicare is spending. Once you've reached that cap, $4,020, you move on to Stage 3, which is the coverage gap, also known as the donut hole. Stage 3 is the coverage gap, also known as the donut hole. And this is where people tend to get pretty confused. Instead of paying a copay dependent upon the tier drug, like in Stage 2, you'll now be responsible for a percentage of the cost of the drug itself. So for a name brand, you'll be responsible for up to 25% of the cost of the drug. For a generic, the percentage is a little bit higher, but because the cost is so much less, you usually end up paying less anyway. Like I said, people tend to get pretty confused and pretty upset because one month they're paying $25 and all of a sudden it jumps up to $75. If this happens, give your broker a call. You're most likely in the donut hole, but if you're not, they can help walk you through it and handle it for you. There is a cap for Stage 3, just like Stage 1 and 2, and in 2020, that cap is $6,350. Once you hit that cap, you'll move on to Stage 4, which is catastrophic coverage. Stage 4 is the catastrophic coverage period. During this time, you are only responsible for up to 5% of a drug's cost. So it's like Stage 3, but it's 5% as opposed to 25%. Now the reason that this percentage is so much lower is to help limit your out-of-pocket costs. They don't want you paying an exorbitant amount yearly on your prescription drug costs. Now obviously this is the most economically friendly, but we hope you don't have to get to this stage. There are many different carriers for Medicare Part D, and as such, there are many different advantages and many different prices. One plan may boast lower deductibles but have higher copays. Another plan may be more expensive but have lower copays that could save you in the long run. So for this reason, we really do recommend contacting a broker who's there to serve your needs. Should you need any help, you can reach us at iHealthBrokers at 888-410-0344. Again, that's 888-410-0344. I hope today's video has been helpful and helped you to understand Medicare Part D just a little bit better. If you liked this video, make sure to click like and subscribe below. Also, if there are any other videos you'd like to see, let us know in the comments or just say hi. We'd love to hear from you. Thank you so much and have a great day.